I would like to ask your permission to use this video for educational purpose and on internet.
Yes.
So patient like you are going to, before this surgery, going to look at this video and educate themselves about their experience compared to yours. Do you have any hesitation sharing your experience with others?
No.
Why not?
Because somebody else, if this will help them, I went through a decade of being miserable.
Okay, tell me about that decade of being miserable.
It started with a simple, my back hurt after softball, and the next morning I couldn't get out of bed, and it was a nerve pushing. I got a shot of Demerol, some medication at walk-in clinic.
When was it?
2006.
So that's more than 10 years ago.
Yeah, it was a long time ago.
Okay.
And that started it. Then months went by, I was fine, and then I started feeling my back hurt, and then there was a slow progression that I went to multiple physical therapy appointments. I went to many different chiropractors. I had the steroid shot twice. First time it would work, and then a month later it felt terrible, or a year later it felt terrible, and then because I'm busy in life, I don't go to the doctor right away, and you kind of live with it. And finally I got to a point where I don't want to live this way anymore.
Tell me about toward the end after. No.
I went to a physician in the cities, a surgeon, and we went through the same type of procedure you'd go through at any doctor, where they push and have
examine
you
you.
put pressure.
They do a neuro exam. Okay.
And I never had a problem with that. I could stand on one leg. You could have me do anything you wanted. I didn't have pain from that. My pain was sitting and laying a certain way, and I've been an athlete my whole life, and then I went to that person told me to take calcium and vitamin something, D or B.
No, just let's say a year and a half back. Describe to me your pain and daily activity before the surgery. 6 months before to the time of the surgery.
I couldn't play a game, like I couldn't golf anymore. I couldn't play softball if I wanted to. I could still play old man hockey because of the way I skate. I don't have pressure on my lower back.
What is old man hockey?
Where you don't hit each other, or it's not very intensive.
Okay.
But I still had discomfort in my back.
1 to 10, how bad was it when you were doing activities that you like to do?
Every single day of my life was a 6 or a 7, just every day. And then when it got bad, it was in that 9 range, where my wife and I were in the Louvre in Paris, and I had to lay down on a bench, and I was there for 20 minutes. She had to help me get up, and then from lots of walking and standing in line and everything, it really put it through the roof.
By the way, I have myself back problem that needing help to get up. I know what you're talking about. And I think because I have the same kind of back pain, that gives me a good perspective for my patient, what they have to go through. Now, so your pain is 6, 7 every day, sometimes up to 9. And a professional look at your films and offer you, or look at you and your symptoms and offer you vitamin pills.
They said calcium. They said that he has other people that have taken calcium and vitamin, I think it was B, and it helps it. And I took it.
Didn't do much for you?
3 months, I probably in nothing, and I knew it wasn't going to. I knew. I mean, I've seen my MRIs. When we met, I pointed out, there's my problem. You go, exactly right. I'm not a physician, but I could see it on the film.
Long story short, you had what we call the degenerative disc disease, the disc herniation, and part of the cushioning between the bottom disc, bottom to bone, the cushioning was gone, and that was giving you your pain. This is what we did about a year ago. Now, not even a year ago. It's about 11 months or something.
December 27th is the day we had surgery.
So 10 months, about 10 months ago. So, and we did an OLLIF procedure, minimal invasive procedure here, and screws are good, bone is growing. Do you remember the surgery?
Yep.
How long did you stay in the hospital?
I stayed because when you finally could get me in to do the surgery, it was mid-afternoon, and we couldn't get the OT or the PT people in yet. And I kind of liked it because it was a really nice hospital. The next morning they came in, and they would have let me go right away in the morning, but I was waiting for my ride.
Okay, so it just stayed one night.
One night.
Many of the patients I do that surgery go home same day. You're absolutely right about that.
Like, I got up to go to the bathroom by myself. I went for a walk.
Yeah. Now, your surgery was literally about 35 minutes, and we lost about 1/5 of a cup of coffee blood. You went home less than 24 hours, and we can repeat that. And I tell many of my patients, it's not about that the surgery is fast. I'm not rushing the surgery, but the way we do the surgery, it doesn't really require me cut the muscle, cut the bone. It is just faster. Now, many of my colleagues telling me that don't tell you're fast. And in your case, in a young person like you, if it's a half an hour, 1 hour, 2 hours, it doesn't really matter that much. But especially in elderly people, people who are obese or people who have other problem, it makes a huge difference if a surgery is half an hour or 2 hours. So that didn't give you any direct benefit because you're young, you're not big, you don't have diabetes and so on and so forth. But the question is, what do we do in the rest of, if you achieve the same surgery result in half an hour versus 2 hours, what are you doing in the next 1.5 hours? And the answer to that is we cut the muscle, we cut the bone, we cause bleeding, we cook the tissue, and all of that we didn't have to do for you. That's why your surgery was 35 minutes. And not causing those damage is what enabled my patient to go home same day or next day. And you tell me, how is your pain?
Well, the only discomfort, I wouldn't even call it pain. And you told me this before we did the surgery. The only discomfort I had where I took the prescribed medication, I took it because people told me to take it. Because if you don't take it at the end part, it'll really hurt. It's a problem. So I took it, but I was also conscious of this is a highly addictive medication that I have. So I took it like I was told for the first prescription worth. And the only reason why I had it refilled is because when I think you said we got to push that nerve over to get at a part. It caused a lot of discomfort in my left leg initially, and I only took the pills at night because I couldn't sleep otherwise. I just roll around. And during the day, it hurt, but I moved around and it was fine. It was at night. It was the only time I took the medication, and I did it for maybe 3-4 more days, and then I just stopped taking it, and the pain went away.
Well, that is actually very unusual for this kind of surgery, a spinal fusion, that you needed only 2 prescriptions for this surgery. Okay, yeah, and practically, you're telling me within a good part of a month you were off narcotic?
I was off 10 to 12 days after surgery. I stopped taking all the medication.
That is very, very short. And again, because we didn't cut the muscle, we didn't cut the bone. And that was as well because you had the initial nerve irritation, which 1 in 7 of our patients get. But as you just described, it has a very good prognosis. It gets better pretty fast. Now, right now, generally with your usual daily activity, how's the back pain?
Zero. Non-existent.
Okay, well, that is already the proof that this was a real problem that was fixed with that surgery. And I agree with you. I don't believe that was a problem that just vitamin pills would fix. Okay, but
the only discomfort I have from time to time is if I lay down for a while or if I'm watching TV and I get up to go possibly like lift something. But I think it's more of my muscles are sore than anything else. It's not the same pain.
And I want to add something. Do you mind to hold this? This is the disc that we fixed for you. Here, this disc, they look fine. They look actually great. But generally, this is just a statistic. We tell our patient that if you have a problem in any spinal level, with or without surgery, you are more likely to have other spinal problem. That risk is I consider it about 35% more than average person for this. Now, this here is where your spine connects your pelvis. We call that sacroiliac joint. We call it a joint, but it's not a joint. Only a pregnant woman during the birth process, open it up for the baby to pass through the pelvis. In your case, this is not in a great shape. As a matter of fact, I'm going to turn around and show it here. This is the sacroiliac joint. You see it has a rugged surface and a little bit of a bone spurs there. Nothing unusual. Lots of people, even younger people, healthy people have that. That by itself is not going to now tell us that it's going to be a problem in the future. But we know if you have any kind of spinal fusion or spinal problem, you're about over 40% chance to have problem of this joint in the future. How can we counteract that? How can we reduce that risk? Is by keeping the muscle in that general lumbar spine and pelvis healthy and strong. Do you remember those exercises that the physical therapy did with you? I think the most favor you can do to yourself doing those exercises every day. Okay?
Okay.
Any question otherwise?
No.
No. If you could go back 5 years back in time, would you have done anything differently?
I would have done this sooner.
Sooner. Okay. I hear that a lot. Well, thank you so much for the interview. I really appreciate that.